My name is Caitlin Hart, and I am with East Idaho News. Today I am sitting here with Police Chief Johnson, and we're going to talk about the new opioid response plan that IF Fire Department and Idaho Falls Police Department are issuing out on the 31st, right?
Yeah, that's Overdose Awareness Day, International Overdose Awareness Day, so we're trying to time it with that.
Awesome. So tell me a little bit about this new plan. What is different from what you've been doing in the past to this now?
Opioid deaths are just a tragedy. Overdose deaths are a tragedy, and once someone has passed, there's nothing that we can do at that point, you know. So what we really want to do is make it so people aren't dying from this horrible epidemic that's taking place. So the first stage of what occurred, the fire department kind of took the bull by the horns with this, is they started leaving a naloxone leave behind pack when people would overdose. And so there's more of that out there to keep people from dying, which was a great first stage. And it's been a great program. A lot of places where we go now, where we see people, there's naloxone in every room, so people are aware of it and they know it, and we're having fewer deaths. But now what we want to do is just keeping people alive and not having the deaths. That's the first stage. We want to try to encourage and help those folks to change their life and to recover from addiction, and we want to be part of that. So what this plan is we hired a social worker, which is a new thing for the police department. There was an opioid settlement that the drug companies made with a lot of state governments, and Idaho was part of that. And as part of that settlement, Idaho Falls got some money, and there's strict rules about what you can and cannot spend that money on. Like, I can't spend it on hiring police officers or anything else. It has to go to opioid reduction and things like that. So this program fit what that money could be spent on. So we hired this part-time social worker out of that opioid addiction recovery money. And they're teaming with one of our detectives, Detective Rome Stifler, and they're going out and they're responding after someone overdoses, and they're within about 48 hours, 72 hours after, contacting them. We've got some partners in the community from the recovery community about different treatment centers and stuff like that. And so they're talking to them, giving them the information about how they can get into treatment, where they can get into treatment, how they can turn themselves around. We've done some fundraising with the Greater Idaho Falls Police Foundation, so we've got some money for some scholarships to help people afford that treatment. So there's some capacity there to help people pay for that as well. And so we're really trying to work hard on helping people stay alive and helping them change their lives so they're not addicted, because we don't want to have to arrest as many people as we currently are.
The plan is to help those who are seeking treatment,
Correct.
Are looking to get some help, because on the other side there's people who don't want to get that help. So can you talk a little bit about the discrepancy between those two things?
Yeah, so if people don't want help and they're out causing hate and discontent in the community, we're going to go out and we're going to arrest them and do that as vigorously and as actively as we can. In just the last 3 months, our narcotic detectives have gotten 9 federal indictments on local drug dealers and many more arrests. We've seized over 100,000 fentanyl pills. It's well over 100,000. Just in the last months alone, we had that really big seizure of 70,000 pills, which was the largest one in the state. So we really want to impact that supply side. We want to hold people account for the bad things they're doing. If they have warrants or if they're out stealing stuff to pay for their habit and they're not seeking help, we're gonna focus our enforcement activities on those folks. For people that want to get help and want to get into treatment, we want to be able to help facilitate that also. So that's what this program is designed for, is for those folks that are struggling with addiction, that want to change their lives and want to get some help. We have a way to go out and reach out to them to see if that happens, and then we have some resources to offer them so they can get into some recovery.
Okay, so this new plan is also under the COPE program, which is the Community Outreach and Partnership Education.
Yeah.
Okay, so talk to me a little bit about the COPE program. What is the difference between that and how is this one going to be underneath it?
The whole COPE program, there's a lot of overlap between mental illness, substance abuse, some of the homeless problems that we have. There's a lot of overlap between those things. So that program, it's really focused on mental illness. We have a large call volume that is directed at people that are struggling with mental health in our community. So the same pair of people, the police detective and the social worker, they'll do follow-up visits with folks that are struggling with their mental health, checking to see if they've gotten into whatever treatment that they qualify for, that have been going to, making sure that they're doing as good as they can, helping them to not go back over that line to criminal behavior. We'd far prefer to help folks that are struggling with mental health to seek treatment through the mental health services as opposed to the criminal justice side of it. And so they're helping people to stay out of the criminal justice system and to get the help they need. They make referrals to a lot of mental health professionals in the area. They partner with other organizations, and so they're really involved in that. You know, there's a lot of overlap between that and the homeless populations. Being homeless isn't necessarily illegal, right? It's just a status. If it's also, being homeless is not an excuse to do illegal things. And so when we get word or information that there's homeless people being at certain places or being in places, we'll send this team out to contact them, see if they can get into any services, see what we can do to get them off the street and to take advantage of that, to let them know that if they do commit criminal activity, that's something we would enforce here in Idaho Falls. We like to have that be the first contact. And then if they choose not to accept that and they engage in criminal activity, we'll go out and do what we do and do arrests and things like that also. So they're also an outreach team for the homeless folks as well.
Okay, so more so getting to them before they have the opportunity to be in the criminal justice system, to be arrested,
Yeah.
to help them beforehand.
Yeah.
Okay.
It's the same concept, whether it's mental health, substance abuse, homeless. You know, they're trying to impact those quality of life type of crimes that people engage in. It really affects the community. People engaged in it, you know, we want to keep them out of jails unless they need to be in jail, and give them an option that doesn't include jail.
So I saw that some of your officers and some of the firefighters in town from the Idaho Falls Fire Department went to the PARI conference recently to learn more about individuals with substance abuse and how to help them. Tell me a little bit about that conference and when it was.
PARI's Police Assisted Addiction Recovery Initiative. It was started, probably a decade plus ago. You know, they had so many overdose deaths, and their chief back there just decided we just can't have this many deaths. So he made a program that would help people get into treatment. And so we went back. We knew we had this opioid settlement money. We knew we needed to use it to help people recover from opioid addiction. The PARI program is listed in the settlement with the drug companies as something that's approved to spend the money on. It's been pretty useful in other jurisdictions. So we went back there just to see what they were doing. And a lot of what they were doing, Idaho Falls was already doing, like the harm reduction, where the fire department was going out and already leaving those leave-behind kits. This response within 48 to 72 hours after an overdose, this is the next stage of that PARI program, so we're doing that, and we're up and running for that now. The last part of it we'll be trying to implement in the future is called the Angel program, and that's a little bit of like if you have a family member that's struggling with addiction and you don't know how to help, you can connect with a police officer. And the same thing, if they're out there causing hate and discontent and stealing stuff and don't want help, we'll still come out, but there's a police jail response for someone with that. But if someone's really you know, wanting to get some help and wanting to get into addiction, we would have a method to help facilitate getting into that. So that's the next stage, which is the Angel program. So we're at stage 2 of a 3-stage program, and we're excited to see how stage 2 works.
Awesome, as are we. Speaking of your officers, obviously they're going out and they're seeing a lot of these opioid deaths and they're witnessing the crisis firsthand. So how has the opioid crisis affected a community like Idaho Falls?
So we had quite a few overdose deaths, but that number's gone down, which is a good thing. It's not gone down because there's less drugs, unfortunately, even though we seized a lot of them, just that supply is so huge. But naloxone is just so prevalent now that people are using it, and it's keeping people alive. So we aren't responding to as many overdoses this year as, say, last year. But yeah, it was a lot of trauma in the community where we had a lot of people passing with overdoses from fentanyl. It was a tragedy.
With this new plan, what do you hope will come from it?
We hope that, you know, we're starting small. We don't think we're going to change the world. We hope we may one day. If we can help facilitate a couple of people to get off of drugs and to be able to enjoy their lives a little bit more, that'll be a huge success with this. That's what that opioid settlement was designed to do, and that's what we're trying to do. So we're hoping to impact, hopefully, you know, 5, 6, 7, 8, 9, 10 people's lives and help them recover. In their lives, that will be huge. For their families, that will be huge. Take that as a pilot program, take that as a success, and see where we can grow it from there.
So a lot of the reason that people are being addicted to opioids, some of the time is because they're getting prescriptions for these medications. So what is being done to prevent that from happening in the future? Because I know that obviously opioids are given for pain and people can get addicted to them really fast. So what is the gateway there to getting past that?
The medical profession, the pharmaceutical profession has come a long way. We don't do policing today the way we did it 10 years ago, and they're not doing doctoring and pain management today the way they did it 10 years ago. If we were having this conversation in years past, I would have told you how difficult that was. I think the medical profession, both through government law changes and also them trying to do the right thing, they're tracking that pretty closely. So it's a little bit harder, I think, for that to occur now. They're prescribing fewer pills. You can't get a bottle of 60 Oxycontin anymore, right? They come in smaller numbers. So they've come a long way in helping with that. And so doctor shopping, they're tracking all those things. And so they've worked really hard on that end of it to reduce that, but it still occurs sometimes.
If you wanted to say something to someone who was thinking about getting treatment, about maybe participating in your new plan, what would you say to them, someone that's struggling with substance abuse?
So if they want to get treatment, there's some really good treatment places here. We've got some good partnership with the community. Get yourself into it, and you can't quit. One thing that I've learned as I've done this is people relapse, right? You just can't quit. You got to keep at it and keep doing it. We're happy to be part of that. We'll help connect you to the resources. We've made those contacts. We have a little bit of funding to help bridge the funding gap. That's a concern for us. It's not a lot, but a little bit. We've had some really good public partnerships. We got about $7,000 donated, which we think would help about 10 people, maybe a little bit more. So if that's something people are in need, let us know, and we'll come out and do our best to help you.
That $7,000 you're talking about, I know came from the Greater Idaho Falls Police Organization. So I know that you guys have been working with local treatment centers and recovery centers. What has that been like to be able to go out into the community and help these people that are trying to help other people?
It was pretty cool. We had a big meeting, and we had a bunch of people there. Andre's house. I'm going to miss some of them. Forgive me. I'm not going to rattle them all off because I don't have them right in front of me. And it was the first time we had ever all sat down together, and it was kind of, we're all looking at each other kind of like, I don't know, are you serious? I don't know, are you serious? And it was kind of a really fun experience for me, because I think, by the time we get to the end of this, we're all going to understand we're all just doing our best to try to help people live better lives, right? We have different roles to play in that, but the ultimate goal is the same. We want to help people live better lives and enjoy their lives as much as they can. So that community partnership's been great, and we've learned a lot from those treatment centers. I had my idea of how this was going to work, so I went to some training, and they told me to do it this way, and luckily we got some really great treatment centers, and community partners said, no, that's not how it will work here. Here's how it will work here, and this is what we can make happen. And I went, okay, we'll do it that way, because that's how it will work here. So they've been great partners, and we're grateful for them.